Good evening, I'm Tegan, and tonight we are taking a closer look at norovirus, a virus that affects millions of people every year. You've probably heard it called the stomach bug, and if you've ever had it, you definitely would remember it. It's one of those illnesses that seems to come out of nowhere, spreads really quickly, and can knock people out for a few days. And even though it's extremely common, a lot of people don't actually know what it is or how easily it spreads. So tonight we are going to break it down, what it is, what it does to your body, and why it's so contagious. So what exactly is norovirus? It's a highly contagious virus that causes something called gastroenteritis, which is inflammation of the stomach and intestines. That inflammation is what leads to the uncomfortable symptoms people experience. And even though people often call it the stomach flu, it's not related to influenza at all. The flu mainly affects your respiratory system, like your lungs and your throat, while norovirus targets your digestive system. So calling it the stomach flu is actually kind of misleading, even though the name has stuck. Norovirus is also considered the leading cause of foodborne illness in the United States, which means it's responsible for more cases of food-related sickness than any other pathogen. One of the most noticeable things about norovirus is how quickly the symptoms appear. After being exposed, symptoms usually start within 12 to 48 hours, and when they hit fast. The most common symptoms include nausea, vomiting, diarrhea, and stomach cramps. And those symptoms can come on very suddenly, sometimes within just a few hours. Some people also experience additional symptoms like a low-grade fever, chills, headaches, or body aches. In most cases, the illness lasts about 1 to 3 days. But even though that doesn't sound like a very long time, the symptoms can be intense and exhausting. And for some people, especially the younger children or older adults, the biggest concern isn't just the virus itself, it's the dehydration. That's because vomiting and diarrhea can cause your body to lose a lot of fluids very quickly. One thing that makes norovirus tricky is how long you can spread it. Most people assume that once they feel better, they no longer are contagious, but that's actually not true. You can still spread the virus for several days after your symptoms stop, and in some cases, people can continue shedding the virus for up to 2 weeks. That means someone could feel completely fine and still unknowingly infect others. This is one of the reasons outbreaks can be so hard to control, because people may return to work or school or activities before they're completely stopped spreading it. Norovirus spreads mainly throughout what's called the fecal-oral route. That might sound complicated, but it basically means that tiny microscopic particles from an infected person end up entering the person's body. And it doesn't take much. This can happen several ways. One of the most common ways is through contaminated food or water, especially if someone who is infected prepares food without properly washing their hands. It can also spread through direct contact with an infected person, like caring for someone who is sick. And another major way it spreads is through surfaces. If someone with norovirus touches an object like doorknobs, countertops, phones, or shared equipment, the virus can stay there. Then, when another person touches that surface and then touches their mouth or eats, food can become infected. Why it spreads so fast compared to other illnesses? First, it only takes a very small number of viral particles to make someone sick. In fact, fewer than 100 particles can be enough to cause infection, which is extremely low. Second, the virus is very durable. It can survive on surfaces for days, especially in places that are frequently touched. And third, it's resistant to many common cleaning products. That means regular disinfectants might not always be enough to fully eliminate it. Another factor is how quickly the symptoms appear. because people may not realize that they're infected right away, they can spread the virus before they even know they are sick. And when you combine all these factors, low infectious dose, survival on surfaces, and delayed awareness, it creates a perfect condition for rapid outbreaks. So overall, norovirus is not just common, it's extremely efficient at spreading from person to person. And understanding how it works is the first thing to preventing it. Now that we've covered what norovirus is and why it spreads so quickly, Lauren will take a closer look at the data behind it and who's most at risk and where outbreaks happen most often.
Now that we've talked about what norovirus is and how it spreads, let's take a closer look at the bigger picture, specifically how often it happens and who it affects the most. When we look at norovirus from an epidemiology perspective, the numbers are actually pretty surprising. This is where we start to understand why it's considered such a major public health issue. In the United States alone, norovirus causes between 19 and 21 million cases every year. That means about 1 in 15 people will get norovirus annually. It also leads to about 109 hospitalizations each year, and unfortunately, it's responsible for about 900 deaths annually, mostly among high-risk populations. In epidemiology, we use the term incidence to describe the number of new cases over a specific period of time. And with tens of millions of new cases each year, norovirus has a very high incidence rate. And what makes this even more important is that many cases go unreported, so the actual number of cases could be even higher. There are a few key epidemiology terms that help explain how norovirus spreads. One of those is outbreak, which refers to a sudden increase in cases in a specific place or group of people. And norovirus outbreaks happen frequently because of how easily it spreads. And another important term is transmission, which describes how the disease moves from person to person. As we heard earlier, transmission can happen through contaminated food, services, or direct contact. And there are risk factors. These are conditions or situations that increase someone's chances of getting infected. Understanding these terms help public health officials track and control the spread of disease. When it comes to norovirus, certain groups are more vulnerable than others. Young children are at a higher risk because their immune systems are still developing, and older adults are also more vulnerable, especially because they're more likely to experience severe dehydration. And people in shared living environments are also at a greater risk simply because they're in close contact with others. In these groups, symptoms can be more serious and sometimes require medical attention. This brings us to high-risk locations, places where outbreaks are more likely to happen. These include schools, college dorms, cruise ships, nursing homes, and restaurants. In all these settings, people are either living close together, sharing food, or using the same spaces. And because norovirus spreads so easily, one infected person can quickly lead to a large number of cases. For example, in a dorm or school, shared bathrooms and dining areas can make it easier for the virus to spread. In restaurants, improper hand washing by food handlers can lead to contaminated meals. Some of the most well-known outbreaks can happen on cruise ships. This is because thousands of people are in a confined space, often sharing dining areas and facilities. But outbreaks aren't limited to cruise ships. They also happen on college campuses, in schools, and restaurants across the country. In many cases, outbreaks can be traced back to a single source, like contaminated food or an infected individual. The good news is that there are effective ways to prevent norovirus. The most important step is proper hand washing. Washing your hands with soap and water is much more effective than using hand sanitizer when it comes to norovirus. It's especially important to wash your hands before eating or preparing food and after using the bathroom. Another key prevention method is disinfecting surfaces. Bleach-based cleaners are recommended because they are more effective at killing the virus. You should also wash fruits and vegetables thoroughly before eating them. And one of the most important things, if you're sick, avoid preparing food for others. Staying home when you're infected can significantly reduce the spread. And regularly cleaning shared spaces can also make a big difference, especially in high-risk environments. When it comes to treatment, there is no specific cure for norovirus. And because it's a virus, antibiotics won't work. The main focus is on managing symptoms. This usually means getting plenty of rest and staying hydrated. Drinking water, electrolyte solutions, or clear fluids can help prevent dehydration. In more severe cases, especially for young children or older adults, medical care may be needed. Overall, norovirus is an extremely common, highly contagious, and capable of spreading very quickly in the right conditions. But understanding the data behind it, along with how it spreads, can help reduce its impact. Simple actions like washing your hands, staying home when sick, and properly cleaning surfaces can go a long way in preventing outbreaks.